children also. She decided she was done at 16. Tell me. Started at 16 and finished at 46. Wow. Single.
I am Louise. I work for Arlington Pediatric Dentistry. Kaylee is in the back. She's my helper today. She also works there with us. And just a short note, I know that you ladies are going to be leaving and all the children are going to come in and we're going to talk to them doing my dental tour talk that I do. And she will be handing out little toothbrush bags to everyone so their children can go home with a toothbrush at the end. Okay? So what I'm going to do here today is I'm just going to go over some of the most common things that people ask and in the dental field when they come in. And then, you know, after I say something, if anybody wants to raise their hand and have a question, we can talk about each one as we go along. The first one is, what is the best time to bring my child in for their first exam? If you call the general dental offices, they will tell you 3 years old. Pediatric dentistry encourages you bring your children in at 1 year or 6 months after they've gotten their first tooth in, okay? And no, we don't expect them to be in the chair. They'll stay in your lap. We do what's called a knee-to-knee exam. We look at how their teeth are coming in, but mostly we're there to help the parent, educate the parent on the things that you might not be knowing at that point. So and then as the child comes along every 6 months, by the time they're ready to get in the chair, they're already used to coming into the dentist, they're used to the people, and they'll climb in the chair without any issues or being frightened of the people that they're seeing because they've been coming for quite a few years. All right? So 1 year or 6 months after they've gotten their first teeth. How often do you see the dentist? Well, it's every 6 months. And we tell, you know, people say, well, why go? We get this often. Why take a child to the dentist? They're just baby teeth. They're going to fall out anyway. Yes, the front teeth will fall out when they are about 5 or 6, kindergarten. But the back teeth, the little cuspids and those 2 molars, they keep those teeth until they're around 10 to 12 years old. So it's important to maintain those teeth, and those are the ones that we see get decay very easily. And so that's why we take x-rays, so we can see decay. And with children, the decay happens so quickly. They have a very thin hard shell, enamel shell, where ours is a lot thicker. So decay can happen in 6 months. They can have nothing in 6 months. They can have 8 cavities. Because as the teeth are together, you don't just get 1, you get 2. So you can get 2, 4, 6, and 8. And so that's why it's important. A lot of parents say, well, I brush their teeth. But it's important for them to also be flossed. And flossing is something that needs to start happening. As soon as you see that second molar come in at about 2.5, you'll see the teeth come in. Start flossing, getting them used to the floss so that it becomes a routine and they're not battling you. Yes, they're going to battle you for brushing too. So that's another little topic we'll talk about in a second, is how do I get them to brush? So yeah, so it's important to make sure that they maintain that. When do I start brushing their teeth? I get some children come in and their parents haven't started yet, and it's important as soon as you see the teeth come in. You might not be wanting to take a toothbrush because that seems a little bit, but with baby teeth, the front teeth, they can decay very easily, so we want you at least to wipe them. And I'm going to go into talking about that first year is really hard, especially the babies that get teeth early. They can get the decay on the front teeth extremely quickly. and it's called Nursing Baby Bottle Rot. Kaylee has some pictures. I'm going to have her let you guys kind of look at them. These are extreme, and you think, oh, these don't happen very often. We work in the pediatric dental. It happens almost every day for us. We'll see kids like this. And so it is an issue for children. Milk, juice, all of those things, mother's milk, rice milk, anything has sugar in it. It's natural. The mouth doesn't differentiate between added sugar and natural sugar. It's just sugar in the mouth. So when nursing happens and bottle happens, we call it grazing, and the teeth aren't getting cleaned. The milk will sit on the teeth, especially on the top teeth, and you'll see early decay happen very quickly on those. We see 1 year old that their teeth are gone. They're just little black stubs. So it can happen. Once decay starts, it goes very quickly. So what to do about that? You're nursing, yes, we understand it's hard. What we ask is when you're nursing or the bottle, wipe the teeth afterwards, and so that you can. I'm not asking you to take them in the bathroom and brush their teeth, but you have a little cloth, wipe their teeth as best you can. As they get a little older and they're toddlers and they're running around, I get, a lot of people say, well, I give them juice, but I water it down. Juice, watered down, is still sugar. It's still sugar water. So when you're giving your children the milk and the juice, we recommend that you give it to them during their meals and snacks. And when they're done, take it away and give them water in that running around sippy cup, the grazing. Because then the mouth has a chance to rest, and it can be rinsed. And it's not constantly getting what we call a sugar spike every time you take a drink. We're doing it with our coffee, because many of us like it sweet. So every time you take a drink, you're giving your mouth a new full dose of sugar. As adults, we can get away with it. With children, you can't. So that liquid flows everywhere in the mouth. So one of our main things for education is watch the grazing, and then the nighttime. If they're going to bed with bottles at night, with a milk or a juice, just be aware that that can really, because that stuff then just sits there, because they're not talking, they're just sitting. So be careful of the nighttime. When they're toddlers, we understand it's hard, that's what you need to do, but as you move forward, try to get that bottle not be milk at night. Okay? Any questions on that one? Anybody have a point? Yeah. Okay. Alrighty. My child grinds their teeth. How many of you? It is. That is probably one of our #1 questions from parents is, my child, I can hear them down the hall. It sounds like they're going to grind their teeth off. In some cases, they can do a number on their teeth because the teeth are softer than adult teeth. As adults, we wear night guards. Many adults do, because we clench and grind, and it can be very damaging on our teeth. But with children, you can't get them to wear a night guard. First of all, you don't want to, because their teeth, their arch is still growing. It's constantly changing. And if you put a night guard in their mouth at night, that's constricting that growth time. So you really can't do that. So for babies, you just have to put up with it. Doctor says that's why binkies are kind of nice, because they're not grinding their teeth. And there's no milk in it, so a binky is not a bad thing in that time. And then sometimes what we do is when they're about 10, when we have our severe cases, we'll have them go and get an over-the-counter night guard that they can wear. Again, they're usually not very compliant. Adults aren't very compliant on wearing them. It's not anything you can do. It's a stress reliever, okay? And we just have to put up with it, all right? Let's see, the teeth are crowded. What should I do about that? We start sending our children to an orthodontist at about 7.5 when they have all of their front teeth in and their permanent first molars in. Many times we already recognize that they have it, but the orthodontist doesn't want to do anything. And people say, well, they're going to put braces on them at that age? No. Nowadays they have phase 1, phase 2, things like that that are, they're little like expanders, or maybe they might need some extractions of baby teeth. So there's phases. Many times they'll come in, they'll say there's nothing we can do, you just have to wait till you're 12. Okay? So Kaylee's got the thing, whatever, yeah. So those pictures are kind of not, you know, like I said, we see those, but most of the time kids come in and their teeth are fine. But that does happen, and it does happen in our area. With that kind of situation, when we see that, people ask us, besides, you know, changing the diet, is that we look at family history. And if you have family history of high decay, and if you see the child that's got high decay, we do recommend a fluoride prescription. In this area, Smoky Point, there's no fluoride in the water. If you live south of 88th Street of Marysville, you will have fluoride in your water, and then no prescription is given. But up here, in severe cases like this, or cases that you see the decay happening, we do recommend fluoride for the children. It's not going to prevent the decay happening in the teeth already. What it does is that it helps the permanent teeth that are forming come in more resistant to decay. And that's what you want, because sometimes genetics do play a part in kids getting teeth cavities, people get cavities. So, but the first thing we do look at is diet and home care. So we just talked about home care is you're brushing, and we want you to start flossing. We want the teeth to be clean before they go to bed, and sometimes that's an issue, okay? And then brush their teeth in the morning. Parents will tell me all the time about brushing. I can't get them to brush, or they won't let me get in there and brush. We have a little standard saying for the kids: when you can tie your shoes comfortably, then you don't need help brushing and flossing. It's an eye-hand coordination that seems to be clicked on in the brain, and they're more mature enough to understand where it goes. Parents will say, yes, they're flossing, but then come find out they're not flossing the back molars because they can't figure out how to get it, or they're just not doing it because it's too hard. Or we look in their child's mouth and the back teeth are dirty, but the front teeth are clean. Looks good to the parent, but when we look in there, we're like, no, this isn't good. So that is the key. Get them to brush until they can easily. And as the child gets older, let them brush in the morning, and you help them brush and floss at night. So it's one time on their own and one time with the parents' help. Okay? Then some kids do use the fluoride rinse. The other one that parents are asking, and this has been coming up, it's pediatric doctors are suggesting children have fluoride toothpaste sooner than pediatric dentistry is recommending. Has anybody heard that yet? Start giving your child fluoride in their toothpaste and they're 2 years old. Dr. Justin's belief is that wait until they can comfortably spit, which is about 3. And then when you do add that fluoride onto their toothpaste, you just take a little pea size, you rub it into the brush so there's not this glob that they can just lick and swallow. The key is to use it to get the fluoride on the teeth, but not in the system. As again, fluoride needs to be regimented, and you don't want them eating their toothpaste. And when I do my talks with the kids at the schools, there's a few kids still that think it's okay to swallow the toothpaste because it tastes good. Tom's makes it very yummy. It's strawberry flavored, you know, and all that. And I guess it's natural, but if you got fluoride in it, then don't get them. So just do the safe to swallow until you feel. So about 3 is the age that you want to start doing that with that. Okay? Any questions so far? Anybody have any comments about anything? Okay. We talked about grazing. Then the last one is snacks. We talked about the drinking. Kids graze with food, and that's just as hard as kids that graze with their drink. But also it's They love the fishy crackers. They love the fruit snacks. When I do my talks with the class at the schools, half the class thinks fruit snacks is a fruit. Okay? So, how many think is a fruit? Oh, you know. Well, why? And then they'll go, well, why do you think what it is fruit snacks? Because it's good advertising, you know. It's a very sticky, sweet sugar. And the fishy crackers. Crackers are another one. Kids love crackers. Crackers stick on your teeth. The fruit snacks stick on their teeth. You can give them, do a test, give them a fishy cracker, look in their mouth an hour later, you're going to still see fishy crackers sitting on those chewing surfaces. I've had some parents say, I do everything right. They don't graze, we brush and we floss, we do everything, and they had decay all on the chewing surfaces of all their back molars. And they were like, oh, it must be genetic. So then we started getting deeper into it. The child ate fishy crackers all the time. So I'm not saying don't eat them, but add the fresh fruit with it, add the cheese with it, add water with it, add something that helps dissolve it a little bit so they're not just eating fishy crackers, okay? You talked about the fluoride in the water. I know that that's sometimes a big issue, but we're talking on a pediatric, the dental recommendations. We do recommend fluoride for those cases that do. The one thing Snohomish County wants me to let you know, and I've talked with them, is that if, first of all, you want to look at your family history, which we talked about. You want to look if the child has decay. If none of those things apply, then don't worry about it because you're going in the right track. But if they have decay and you've got that family history, then you want to look at where you live in our community and where that child goes into the fluoridated areas. If, say, they live here, but they go to preschool down in Marysville every day, or then they would get the water there, so you don't want to give fluoride prescription here. Or say they have a split home, you know, you see that quite often. And, you know, half the time they're at mom's, but dad lives in Everett. So, again, you might want to only give it while you have them here. So you want to check your 25-mile radius and where that child goes before you decide if you want to do any fluoride prescription. Okay? Okay, the terrible twos and brushing. How many of you guys are like, oh my goodness, I can't brush their teeth? They're like, acting like I'm cutting their head off. You're not hurting them, just like they don't like the diaper changed, or they don't want to go to bed, or anything else. But children really don't like you in their face, especially in their mouth, in their ears, any of that. They really just don't like that. And about 2 years old, it even seems to become more of an issue. What we recommend, first of all, is always making it a point to do it. And what we do at work is we sing the ABCD song. So pick a song that's short. Twinkle, twinkle, ABCD. Sing it every time so the child knows when the end of the song comes, you're done brushing. Okay? And then they know, okay, it's almost over. Then be consistent with it. And then also, if you have two parents or two people, you could do what's called knee to knee. And what you're doing is you take two chairs, sit together, knee to knee. You wrap the child's legs around your waist, put their head in the other person's lap, hold their hands. The child then becomes sometimes upset, a lot of times, but their mouth is open. And then you proceed. Right? They're screaming. You can get in there, but stay calm. Just stay calm. Sing your song, very sing-songy. Let them know. Put some safe-to-swallow toothpaste on there. Sweeten the pot, as I say. You know, let them know. Let them lick it a little bit. And then once you're in there, and then tell them afterwards, everybody claps and praises, give them hugs, and what a good child they were, and they just brush their teeth. And do that consistently. And eventually, you're going to wear them down. You know, and maybe you don't. Maybe you're not going to. But it's still important that their teeth get brushed. It's more important, just like changing the diaper, it's important to get that done. If you're on your own, Many parents tell me, I can't get to them. I said, well, are you trying to brush their teeth face to face as you start getting a little older with some of the older ones? And they go, well, yes. And I said, well, you're giving them all the power. You're coming at them, they're pucking their nose, and they're moving around like this, and you can't get them. Again, lay them back. With some of the older kids, in our office, we have TV screens, and they lay there, and even we get the 2-year-olds in the chair, and they just watch their Mickey Mouse or whatever, and they're totally like, don't even know what you're doing. With some of our older kids, where they need that distraction, I know everybody has their little cell phones, I see the little ones on there, let them hold it. Put something on there, let them watch it, and then lay them down in your lap and brush their teeth, distract them, give them some kind of a distraction. But lay them down or sit them and have them bring their head back so that you can get in there while their head is back. Don't go face to face because you're going to lose every time, especially with flossing. Because when you're in there, the tongue is going to gag. But if you're laying back, the tongue lays back and then you can get in there quickly. Use these little guys, okay? This is a child's one. This one is okay for your infants, but as your child gets older, their teeth get tighter together, and if you find that you have tight teeth and it's like, hard to get through, go ahead and get the adult glide type floss like you would use, because the easier the in and out, the more compliant the child is going to be for flossing. And then help them learn how to do it themselves. Okay? I think my time is getting close. I don't see my 5 minutes, but it's 1:15. And I pretty much have covered things that I wanted to. Does anybody have questions about something that I didn't bring up or what I did bring up? Yes?
What is it about what's the negative about the fluoride?
The scientific proven negative about fluoride is called fluorosis. It's the only thing that's ever been proven. And in the states, there's some states, the Midwest states, that have natural fluoride when it's hard to control. And so that's where they've done a lot of their tests and all that. And what it is it's a brownish spots on your teeth, sometimes white, and but they have no cavities. But there's no sign of cancer or anything like that. So overfluoride is fluorosis is the only thing, and you have to have a lot of it. And so in our area, it's all regulated in the water. But again, we don't want your child eating a tube of toothpaste all the time either. So it's something that it's something a small amount is great. Over is not good. So we do have sometimes we have kids come in. We call it hypoplasia, and that's not caused by fluorosis. When your child is a toddler, is the most common thing that happens. The child is a toddler, they'll have ear infections, high fevers, things like that, and it goes on maybe for 6 months or whatever. It will go on. The body is fighting the infection that is going on, and at that time, the 6-year permanent molars and the front teeth are forming, and the body is all fighting this infection, and these teeth come in and they're brown. The enamel is soft, and many times they come in and they're already decayed. It's just like very soft enamel. It's called hypoplasia, not fluorosis. And 99% of the time we relate it back to the toddler stage when they were sick. So there's nothing you guys can do. It just happens, and we have to deal with that. Yes?
I can't remember the name of it, but what do you think of that gum that's over the counter that's supposed to help with?
The xylitol, thank you. The xylitol is great. A lot of people say, I don't really want to do fluoride, and we respect that. But some kids really still need to. Xylitol is great. You can buy it now they have online products. I've gone to like the women's show, and they had all these little candies and stuff with xylitol. Xylitol starves the bacteria in the mouth. They can't eat, they can't grow, and they can't do their thing. So if, as a good alternative, a nice, natural alternative, go to the xylitol, and that's definitely a nice thing to use, yeah. And I think it's very sweet, and so a lot of people are using the xylitol, and that's fine too. Fluoride, I think, is proven to be better, but at least it's something. And that's why you see the Trident gum A lot of those things you'll see xylitol on there. That doesn't have very much. Some of the other products, if you find them online in your health things, you want to see xylitol as like the first thing, not the third thing on the list. Right? Okay. Yes, ma'am.
You were talking about north of Marysville.
Yes,
They don't have the fluoride in the water. Now I live in Stanwood. Is that another area that doesn't have?
Has absolutely none. None. You're way up there. There's none. Stanwood has their own water treatment plant, and they can't afford the fluoride, so they don't do it. We just talked to the Marysville district guy just this week because I wanted to confirm. What Marysville has done is they take their water from Everett, and at 88th Street exit, about there, 100th Street, there is it's like a gate, you know, and the water has been held back. Then they've opened it up in the last few years, and so it has trickled up a little bit up here, but it's patchwork. And so he's asked everyone that lives north of that to check and call your water district, to call him, which is Marysville Water, and you give him the address and he'll tell you if you have it or not. You could be across the street from somebody and they would have it and you wouldn't. He says even the time of year, you might have more than not. It's not a perfect system for them right now, but they're trying. Arlington is the same way. They get some of their water from Marysville that gets, it trickles up. So some of it has it, like Glen Eagle, and somehow, but then they get some of their other water, I think it's from Sejawoli from the north, so it's a blend. So you get high and low. And again, you call Arlington, the Arlington, they're awesome. I've talked to them too, and he'll tell you where you are on the map and whether you need it or not. Some is low, some is medium, and some is just not at all. I don't think there's really any normal up there either. So please just call no matter what if you're going to get a prescription or you're interested in that. People ask me, I don't want fluoride at all. From my understanding, you can get some kind of water filters if you wanted to. I don't know how that works. If you wanted to filter out your fluoride, a regular water filter doesn't do that. It just takes out the minerals, not the fluoride. So it's something you'd have to research if that's something you're really against. Okay. Anybody else? Okay, it's 20 after. I think we're good.